did you do to her?
The girl's face was trapped under a rock, hard plaster mask sealed so tight she couldn't breathe, and when the doctor raised the saw, she suddenly lost it, lunging forward and crashing into everyone. Her name was Sarah. She wrote the story down for the doctors because she couldn't speak. She's an art student, and that day she let her roommate use her as a live model for a face mold. What she didn't expect was the roommate walking away right after covering her face in wet plaster. An hour later, the plaster fully hardened on her skin. The roommate tried everything she could think of, but nothing loosened it. With no other options, they finally came to the ER. At first, the doctors tried lifting the plaster from the edges to get even the tiniest gap for air, but the plaster was bonded straight to her skin. Nothing moved. Every pull sent a jolt of pain through her. Even worse, the inner layer could soften from the moisture in her breath, which would seal off the airflow even more. If that happened, Sarah would suffocate. The team checked the guidelines for this kind of mold work. You're supposed to place breathing tubes in the nose and coat the skin and hair with lubricant first. If you skip that step, the plaster locks onto every hair and closes every airway. Clearly, whoever made this mold had no idea what they were doing. So how do you take something like this off? Soaking would take too long. Cutting it with a knife was too risky. One wrong angle and she'd end up with facial injuries. The only real option left was a medical cast saw. But that saw was built for orthopedic casts, not art plaster. No one knew if it would work.
Our plan was to cut around the mouth area and try to open up some small opening around the mouth first to provide an airway for the patient.
Just as the doctor powered up the saw, Sarah's mother rushed into the trauma bay. Seeing her daughter trapped and barely able to breathe, she lost control and started shouting at the staff. They had to escort her outside before she disrupted the procedure. But the second the blade touched the plaster, Sarah panicked again. She jerked upright, knocking over medical trays. They had to stop everything until her mother came back in to calm her down. The doctor decided to start at the mouth area first, to open a small space so she could breathe freely. Once the air rushed in, Sarah's body relaxed. A few careful passes later, they managed to cut the entire mask off her face. And after all that chaos, Sarah's first request was for her mother to take a picture of her. She wanted to post it online. The doctor could only stare at her, not sure whether to laugh or shake his head.
Right now.
It was really scary.
Isn't anyone doing anything?
Karen, we're doing all we can to help Jay, and I assure you we're making him comfortable. We can't pull the shovel out right away without first assessing the extent of the injuries it's caused internally.
A man was brought into the ER after being impaled through his lower body by a shovel. The handle had gone straight up through his rectum. His wife screamed the moment she saw it. His name was Jay. That day, he had been fixing the roof of his house when he slipped and fell, landing directly on a shovel standing upright on the ground. When doctors examined him, they found something even worse. The shovel hadn't gone straight in through the rectum. It had entered from the perineum at an angle, and no one knew how much internal damage it had caused. All they could tell at that point was that his testicles had been crushed. A nurse tried to roll him to check his back, but even the slightest movement made him scream in pain.
He was screaming in a lot of pain, and I don't blame him. If I had a shovel in my rectum, I would be pretty loud too.
His wife arrived at the hospital. She thought he had just broken a bone, but when the doctor lifted the blanket and she saw the shovel still in place, she froze, then started screaming again, begging them to pull it out. The doctor had to calm her down and explain that they couldn't remove it yet. If the shovel had torn a major vessel, pulling it out could cause massive bleeding, and Jay could die in minutes. The X-ray came back soon after. The shovel had entered the body at an angle, about 12 inches deep. It had missed the spine, but doctors couldn't see what organs were damaged. There were signs of air pockets inside, meaning something had been torn. If the shovel had hit the liver or kidney, organs full of blood vessels, removing it could open a fatal bleed. At that point, the shovel might actually be plugging the wound shut. Jay was sent for an MRI for a closer scan.
It took hours to remove that shovel and ensure there was no bleeding, but he came through it fine.
And the results were better than expected. No major arteries had been cut. After several hours in surgery, the doctors managed to remove the shovel safely. A week later, when the surgeon checked on him, Jay was already recovering. The doctor joked that next time he should probably hire someone else to fix the roof. Jay and his wife both laughed and thanked the entire ER team for saving his life.